Welcome back to the Tooth Doctor YouTube channel, and I'm here with Dr. Peter Yu, and today we're going to just get into a little bit of the history of the Tooth Doctor, learn more about how we got started and how important the patient satisfaction is to the Tooth Doctor and the team there. So, Peter, let's get started. When did you start?
I graduated from the University of Alberta in 2003, and I started my first practice in 2009 in the Capilano area, and then we proceeded to have another office out by Tofield, and then later on we had provided another location on the south side in Ellerslie, in kind of the Blackmud Creek, Fulton, Rutherford area. So.
Nice. Now, of those years, I'm sure there's been a large, learning curve, and a lot of changes have happened in dentistry and in you as a dentist as you went along. What are some of the, I guess, memorable moments that you had from your first clinic that, you really knew that this was going to work? Like, this is, we're helping a lot of patients. I love the work that I do. Like, what are some of those things that occurred that made you want to expand into location 2 and then location 3?
I believe that I've always tried to be a dentist that tries to serve the community, and by serving the community, to learn and grow and build excellence in as many different procedures as possible. So one thing I feel that I commend myself on is that we rarely refer patients out. If you need a certain procedure, I can do most procedures. And so we have patients that always come back and they feel comfortable because they're in the same environment. So that's something that we find very helpful. We've had some difficult root canals that normally a dentist would refer to a specialist, but we've been able to serve those and care for those situations, and patients have been able to do it in our office.
Well, that's great. So not having to go to another office in another, place, and sometimes there's a waiting period for that specialist, right? Mm-hmm. So being able to get it done quickly and in the same area, that makes it a lot better for the patient. So maybe let's talk about patient care and patient satisfaction. Like, you've been in business for a number of years now, and let's talk a little bit about your patients. Why is it so important for you to have a good reputation in the community? And, maybe you have some stories surrounding that.
Well, I'll start off with how I am as a dentist. I not try to toot my horn too much, but I believe that when you care for people's finances, when you care for people's actual health, then you're doing the best you can. And I would like to say I sleep well at night, knowing that everything that I do is always for my patient's benefit. Now, an example situation would be is a lot of times when people come in with a toothache, right? That's typically why a patient will come to the dental office. So they'll come in and a tooth is hurting, and it's not stopping. And they're eating something and it just hurts. So what do most people think? Oh, it's not good. Oh, I might have an infection. That's typically what people think. So when they come to the dental office, we look at them, we assess them, take x-rays, and we do some tests. Now, I shouldn't say this or I shouldn't do this, but I'll be honest. When I first started, somebody has a toothache, my first thing was, I think they might need a root canal. Okay. Because we've learned those things in terms of pain and trauma. Is it a root canal or is it not a root canal? Or are we pulling the tooth out? Okay. I will say those are the two worst things that you can do for a tooth. Okay. Pulling the tooth out is obviously the worst thing you can do for a tooth. The second worst thing is doing a root canal. So I've grown in my expertise and experience and understanding, and even actually just my own mental focus to say, hey, what is the simplest thing we can do to make sure or get this person out of pain? Mm-hmm. A lot of times it's actually correcting the bite. I've had numerous patients. I will actually tell my patients 80% of the time you have a toothache, it's actually because there's an imbalance in your bite. So you have tooth pain, actually even tooth sensitivity. You come in, we check the bite and make sure that your bite is balanced when you bite down and when you grind your teeth. And like I said, 80% of the time, that resolves it. Now, people will say, oh, if you have sensitive teeth, you should use Sensodyne. I have had people that have used Sensodyne and it has helped. Yes. But when you have quite a bit of sensitivity, I explain to patients that a lot of times it's because the nerve in your tooth is irritated. So then why is it being irritated? It's because the bite is too hard, too aggressive. Okay. I use the example of a bruise. If you get a bruise and then somebody comes and touches that bruise, what happens? It hurts. It hurts. Why? Because it's your body telling you, hey, I'm damaged. I'm healing. Don't touch me. Right? So you don't touch a bruise because it's an area that needs to heal.
Yeah.
So when you have a tooth that hurts or it's sensitive, what is your tooth telling you? Hey, don't touch me. But what do we do every day?
Eat,
talk, bite, swallow. Every time your teeth are constantly touching each other and contacting. And so when there's an imbalance, and correcting that imbalance will resolve and allow the nerve to calm down. And a lot of times the pain goes away.
Well, Peter, that's uncommon, I would say, that, dentist is looking for no pun intended, the root cause of a problem, as opposed to just going for the standard of care, let's call it. Now, do you get any pushback on that from patients, or are they happy to, work on like whatever you got to do to just adjust the bite? What have the results been? Because you don't hear of that every day. You don't hear of doctors, trying to find the least invasive method to solve a problem. How do your patients react to that?
Most are very, very happy. When you have this notion that you might lose a tooth, or, I might need to do a root canal and and especially the ones that don't have insurance, or that they know, okay, I'm probably going to have to, pay out of my pocket hundreds of dollars. And then when we are able to do things in different procedures where they're shocked and they're happily surprised that we didn't have to go to what they thought. And please don't watch Google videos or YouTube videos on dental pain, because it can be quite scary. That's another topic.
Yeah.
But yeah, we have been very fortunate and happy to have patients where they were happily surprised that, you just shaved my tooth. That's it. And even they come back months later and they have no pain. We have had some patients, unfortunately, that they don't believe in it. They actually think they need a root canal. And so we've done the procedure and, they come back, and unfortunately those situations where people don't believe in trying to be conservative and they just want to believe in what they want. So,
Gotcha. Well, I know that you have a number of positive 5-star Google reviews across your different offices. Maybe let's talk about that and why that is and how you feel about that.
It's very touching, and I do want to say, for all those that have given us 5-star Google reviews, I really appreciate you taking a little bit of your time out to share a little bit of your experience at our office. It really means a lot to us. We find that a lot of patients that are looking for an office, they do look at Google reviews. And when they see their office and they see the wonderful comments that are shared about our staff, our team, what their experience was like, it's very touching. So thank you very much, I would like to say.
Yeah, no, that's great. And it goes a long way to helping somebody else have a good experience with a dentist, right? Because a Google review is kind of like the way that people do personal referrals, right? So before you could just ask your neighbor, oh, hey, who do you use for your dentist? Is he any good? And they would tell you yes or no, or go see Dr. Peter, right? And that's how we do it now in this world is we look at reviews online, whether that's through Google, through Facebook, or Yelp. That's where people are looking for a recommendation. So any recommendations are very much appreciated. Mm-hmm. And the only way that you get that kind of reputation is by actually doing good work, right? And, I think that for us and our family, we use the tooth doctor exclusively simply because he's an excellent doctor and he really cares about what's going on for us, for our family and finances. And if you're looking for a dentist who does the same, go to the tooth doctor. They're awesome. Anything else, Peter?
You know what? I think sometimes the elephant in the room is the 1-star Google reviews. So I'll mention a little bit about that. We do have a few 1-star Google reviews, and it's very unfortunate to see those. We find that a lot of times when patients come in, we know we're not perfect, right? No one's perfect, and we do the best we can. And sometimes situations don't always come about with the best results. But we have noticed that a lot of our 1-star Google reviews, it's usually people come in and again, they're not really what they were expecting is not necessarily what they received, but they never came back to discuss it with us, to get clarity. And so it's tough for us to help. Our focus is always trying to have patient care first, wanting the best for them. To those out there that have given us 1 Google reviews, we hope that we can talk with you and share, give us maybe more insight in terms of, why we do certain things or different procedures. And a lot of times it is a misunderstanding.
All right, cool. Thank you so much, Peter, for your time today. We appreciate it. Thank you so much. And we'll see you guys on the next video.